Hello everyone, Dr. Sharon Wong here. Thank you for tuning in, and today we're going to be talking about acne. Acne is a very common skin disorder, and people will present with a mixture of skin signs, from oily skin through to whiteheads, blackheads, little pus spots which have got heads to them, or in more severe cases the larger cysts and even abscesses on the skin. The majority of acne comes about in puberty, and that's because during puberty we have surges of male hormone, and that happens in males and females. And that male hormone, so testosterone being one of them, can increase the amount of grease that your skin makes. So it drives those grease glands into overproduction of grease, and that is the first stage of making acne. There are lots and lots of treatments for acne, and at its simplest, it could be topical treatments, so products that you apply on the surface of the skin. Moving on from that, you can have antibiotics which are prescribed to you from your doctor, your GP or your dermatologist. And in females with acne, sometimes the combined oral contraceptive pill can be quite helpful as well. In the most severe cases, a medication called Roaccutane, or its chemical name is isotretinoin, can be prescribed by dermatologists, particularly if the acne hasn't responded to some of the simpler treatments or if it's very severe and leaving scarring. A lot of the topical treatments are available over the counter, and it is important to know which are the key ingredients that work against acne. So examples would be benzoyl peroxide and salicylic acid. These are active ingredients which you can easily access in over-the-counter products, which can help, particularly if your acne is relatively mild. In some people, there are trigger factors for acne, and it could be stress, it could be lifestyle factors such as your diet, but also some of the makeup products or skincare products could be a little bit too thick and causing blockage of the pores on the skin and creating acne. As a general rule of thumb, try not to squeeze your spots. What it tends to do is deepen the level of trauma and inflammation in the skin, and you're more likely to get some pigmentation changes and or scarring as a result of picking your spots. So there are loads of misconceptions about acne. First of all, that it's related to poor hygiene, poor personal hygiene, and that is categorically not true. And secondly, a lot of people think that acne is just a teenage problem, and that again is so far from the truth. Acne can remain active for many decades. The majority of people probably do grow out of their acne in their 20s and perhaps in their 30s, but we certainly as dermatologists see active acne in the 4th and 5th decade and sometimes even beyond. So it's much more like a chronic condition that can wax and wane during your lifetime.